Message is a vital component of the George Institute's global commitment to addressing health inequities, and especially its commitment to improving sex and gender equity across the life course.
Because, of course, there is such a thing as the male norm. For a very long time in biology and biomedical research, we were effectively only studying male bodies. That meant a great host of medications arrived on the market having never been studied in female bodies and never having properly studied sex as a biological variable.
We see all too often that the findings of research conducted primarily or exclusively in one sex or gender are presented as relevant to all people. This perpetuates the one-size-fits-all norm and can have harmful knock-on effects when evidence is used to shape clinical practice.
As a woman living with HIV, research has been incredibly important to me from the time of my diagnosis. Despite the tremendous progress that we've seen in HIV and HIV research, women with HIV continue to be underrepresented in clinical trials, despite the fact that 52% of people living with HIV around the world are women. The women that I speak to are very keen to be involved in research, but we want that research to be meaningful, not for us just to be brought in at the end as an afterthought.
So meanwhile, our team back in the UK in 2021 did some preliminary research which showed that not one research funder had a sex and gender policy in place for the research that they were funding in the UK. And so we started Message with a focus on funders to profoundly improve the quality of medical research in the UK by increasing sex and gender inclusion.
The Message policy framework has been designed as a template for funders to use to adopt their own sex and gender policy. Understandably, researchers and funders have several questions about how to account for sex and gender in a scientifically rigorous way. And through our co-design process, we've been consulting with a large range of experts to address these concerns.
And the Message projects really sort of champion this sector-wide approach. We need everyone to come with us, looking at sort of the best practices, coordinated strategies, doing it similarly across many funders, which we know is important.
I so much welcome these recommendations, which have come from the kind of collaboration that I've never seen before in 25, 30 years of working in UK medical research. A collaboration between editors, publishers, researchers, clinicians, patient representatives, regulators, funders. It just doesn't happen, and it should happen more often.
And I think Message is doing really, really good work here to get us somewhere where the UK can not only match what the United States has been able to do, but improve on it. What you get here is actually improved scientific models that better represent the bodies that you're trying to study. What you get here actually is an enormous potential for future treatments that are better individualized. And weirdly, what you also get here is better research to support medical treatment for male bodies.
So as you've heard, the Message project aims to integrate sex and gender as a fundamental consideration in health research. Welcome, super supportive of this. This aligns seamlessly with our vision of a future where health research is fully utilized to solve urgent health challenges.
And I think that what the Message best practices are going to do, they're going to accelerate this rebooting of the research ecosystem. They're going to accelerate the rewriting of the knowledge base of medicine. And reiterate, at the Lancets, we're super excited by the opportunity that the Message project presents. Thank you. We will do everything we can to see its vision is fully realized.
We feel very strongly we're now at a significant turning point in ensuring research works for everyone in our society. And this relies on your commitment and enthusiasm to spread the message in your communities and through the example of your work.